Okay, sir.
Yes, sir. Okay, very good.
Yes, sir.
Okay, sir. All right. Thank you. So, first of all, sincere apologies for the inconvenience that caused during the earlier presentation due to network issues. So, the second part of the session, we will be starting about the first aid. So, basically, what we learned in disaster management is very few things. How much our country, nation is prone for the disaster profile of our nation, what exactly is a disaster and disaster management, what are the five important phases of disasters we learned. In the five phases of disaster, the first will be the rescue and the relief. In the rescue and relief, the very important aspect will be the life-saving aspect, that is first aid. So in this part of the presentation, we will be learning about the first aid, what exactly is a first aid, so how we have to do the life-saving measures in emergency. We call it as ER, emergency response, not as a first aid. So it's a emergency response in a situation of any emergencies. So how exactly we do that? Before going to the first aid, please understand in the disaster response, we will be supporting the affected families with basically with the humanitarian assistance. So when we use the word humanitarian assistance, it means to say food, water, shelter, healthcare, and sanitation. So it is very important. All these five aspects need to be supported to the people who have lost everything. So like in a situation of a flood or in a situation of a probably an earthquake or a flash flood, the very important thing will be food and water, shelter, sanitation also. So I remember one of the example from my experiences from the past is most of the relief camp when we visit, we can see more than 500 people will be shifted to one school or into a one building, a public building, or to say the government building, but there will be hardly one or two washrooms or the toilets will be there. So there are 600 people who will be residing in that school or a public shelter for weeks together. So that results into open defecation practices, that results into an outbreak of a cholera and diarrheal disease also. So it is important to remember that when it comes to disaster response, it is not only giving relief material or not only. Sir,
अध्यक्ष सेशनचे फीडबॅक द्यायचे तेवढंच
Dr. Ramesh sir, please mute ಮಾಡಿ sir.
Okay, thank you, sir. So basically, remember the five important aspects related to humanitarian assistance. So now it is called as a HADR. In terms of armed forces, we call that as a HADR. HADR means humanitarian assistance and disaster relief. So when it comes to humanitarian assistance, it's food, water, shelter, sanitation also. So sanitation inclusive of shelter. It's not that only shelter. Then comes the other issues like relief or providing them financial support, rebuilding, recovery process, everything will start. So this part of the presentation will be focusing mainly on the first aid and emergency response. So what exactly is a first aid? So first aid means to say it's a first order help that is given to an injured person in case of any disaster or an accident before the arrival of medical help or before shifting them to the hospital. So this first aid doesn't mean only putting bandages. It means a life-saving measure to be taken during the golden 1 hour. So please remember when we were talking about the mass casualties, triage and mass casualty incident management, the very important aspect is a golden 1 hour and platinum 10 minute. So this is a new term which you may be hearing now is platinum 10 minute. What is platinum 10 minute? When a person goes unconscious and not breathing in a situation like a drowning, he's drowned in a water, or in a situation like a fire or a building collapse or a road accident. So immediately we have to start doing the CPR, cardiopulmonary resuscitation, or the basic life support. So that is called platinum 10 minute. Platinum 10 minute means to say a person will be alive only for 8 to 10 minutes after the breathing has stopped. The brain cells will get irreversibly damaged after the breathing has stopped for 8 minutes. So that 8 minute to 10 minute, we call that as a platinum 10 minute, where our help or intervention is required. So please remember golden 1 hour in first aid and platinum 10 minute, that what exactly we are supposed to do. So any emergency situation. So generally emergency situations can be of either a road accident or a drowning during a floods or a forest fire or a health emergency like a heart attack, fits and convulsions, stroke. So these emergency situations demand a first aid. If we don't give a first aid at that moment, the person, by the time he reaches to the hospital, he may be no more. So first aid is very essential in case of all these emergency situations. So road accident, train accident. So these things have been mentioning that in the past, like a disaster, the major disaster, the man-made. Sir, I request you to mute your mic, sir. Okay. So what will be priorities in managing mass casualty? That is, a triage is the first priority. Crowd management is a priority. So in any disaster, please make sure that it is very important. We have been sensitizing the administration, the first responder regarding crowd management, but we are not addressing this issue to the people only, because people are the one who will be curious onlookers. In any such situation, they will assemble in big number. So they are blocking the way for the emergency vehicle movement. They are blocking the way for the shifting injured. So they will be just making videos, taking photos. So crowd management is again one of the very important aspect in any major disasters. So if we don't manage the crowd properly, that is going to affect the platinum 10 minute and golden 1 hour. Golden 1 hour means to say, if the road is completely blocked due to the people, the curious onlookers, so it is very difficult for an ambulance to reach to the spot or move from the spot to the hospital also. So in the managing casualties, mass casualty, the first thing to be remembered is triage and the crowd management. So when it comes to first aid, so what are the major things to be remembered? Why we do first aid? The first aid should be done for the first thing is to preserve life. So what is preserving life? Preserving life means to say supplying oxygen to the brain till the person reaches to the hospital. So we are not saving life there. We are preserving life. The person is already unconscious and not breathing. Imagine a situation of a fire. If there is a fire or break is there, somebody is trapped inside a fire, he swallowed lot of smoke, resulting into unconsciousness. And immediately, if we do not take a measure to preserve his life, he may not be alive till he reaches to the hospital. So first P, we have three important P's for the first aid. The first objective is preserving life. The second objective is to prevent the situation from worsening. If he's having a severe bleeding after an accident, the bleeding needs to be stopped. So if we don't stop the bleeding, that can result into a shock, that can result into death also. So the second P, the objective of first aid, ಎರಡನೇ ಉದ್ದೇಶ ನಮ್ಮ ಫಸ್ಟ್ ಏಡ್ ನ ಉದ್ದೇಶದಲ್ಲಿ, that is ಇರುವ ಪರಿಸ್ಥಿತಿಯನ್ನ ಉಲ್ಬಣಗೊಳ್ದಿದ್ದಾಗೆ ನಾವು ನೋಡ್ಕೊಳ್ತೀವಿ. So to prevent worsening. So it is not only just putting a bandage, first aid means to say. And the third P stands for promotion of recovery. Recovery means to say it will reduce the pain. It will help in recovering the injury also. So when it comes to first aid, there are 7 important priorities has been set. The first priority is to examine what exactly happened to the injured person. So don't give him water. We have seen generally in any situation, people tend to give water. So giving water to an injured person will aggravate the situation. The person may go for an unconsciousness. He may die due to choking also. So water is never a priority in providing assistance to any injured person. Please remember that if a person is not conscious, don't give water. Water is not a priority. The water will not help in reducing bleeding. There is a myth among the people that water will help to reduce the bleeding. Water will help to recover. Definitely, we can give water when the person is conscious. For a person who is unconscious, who is having a noisy breathing, a person who is semi-conscious, Water should not be given. If you are giving water, we are aggravating it. So what should be the first priority? The first priority is for the examination. What exactly we do in the first priority is we examine for the Dr. ABC. So what is Dr. ABC stands for? D stands for danger. We need to clear the danger. For example, the danger may be, for example, a road accident, approaching vehicle may be a danger. You need to either move yourself on the patient and the casualty away from that danger. Sometimes a live electric wire may be danger. In some situation, probably danger may be nearby fire or a smoke or something like that. So first thing to be remembered is you should be safe, casualty should be safe, move the danger away. The second thing to be remembered, check the response. So we call this method as Dr. ABC method. In any primary survey, in the first aid, remember Dr. ABC, DRABC. So what does the DRABC stands for? D stands for danger, remove the danger. Second, check the response, the person whether he is conscious or not. If the person is not responding, if he is unconscious, so immediately we call the emergency helpline number. So in emergency helpline number generally is 1112. So this is becoming our national emergency number. Remember 112. Okay. So generally you may have called many a time 112 number for any emergency, fire, flood, road accident, health emergency. Remember 112 or 108. So that is one number. If you are traveling in a train, if the emergency happens on train, you can call the number 139. 139. That is railway helpline number. Train ಒಳಗಡೆ ಯಾರಿಗೂ ಹೃದಯಾಘಾತ ಆಗಿದೆ, ಒಂದು ಫೈರ್ ಆಗಿದೆ, any emergency inside the train, the moving train, you can call the 139 and the help will be, you'll be getting help immediately. So remember Dr. ABC, D stands for danger, response. Then we open the airway. Why airway needs to be opened? Because the tongue will fall back, blocking the airway. Head should be tilted to move the tongue away from the airway. Second, check for breathing. So how exactly we check for breathing is not by keeping the fingers near the nose. That is a wrong method. So checking breathing is by look, listen and feel method. We look for the chest movement, we listen for the breath sound, we feel the hot breath there. And the third C stands for circulation. That's a pulsation. I've seen in most of the accidents, when we go for assisting them or helping them, I'll be traveling a lot. I have seen the people checking the pulse wrongly and saying that the person is no more. So radial pulse means to say the pulse which can be felt near the hand. It may not be felt during any emergency. So we need to check the pulse in the neck, that is called carotid pulse. So proper checking of pulsation should also be taught to our students. It is very important. I have seen many science students, they don't know how to check a simple pulse also. So it is very essential and a basic knowledge for any individual to check the breathing and pulsation. Okay, so then we do the secondary survey. We check for the injuries and any condition where there is a lack of breathing or a heartbeat. Immediately we start the CPR. Then in case of a severe bleeding, that is also a medical emergency and a state of unconsciousness. These are all the emergency conditions which should be remembered. So we are going to learn now step by step various methods to be learned in management of wounds. So the first category will be the red category of injury where a person is unconscious. We cannot provide any first aid to them. We have to shift them as early as possible to the hospital. The second category of injuries, that is yellow category, there the bleeding may be there. So bleeding can be from the external or it may be internal. Internal means head injuries, abdominal injuries and the chest injuries. Recently, if you have seen the stampede of Kumbh Mela or stampede that happened in the Tirupati, most of the crush injuries or the stampede injuries requiring a mouth-to-mouth breathing and the CPR also. So here the bleeding needs to be stopped. So there are various types of bleeding: arterial bleeding, venous and the capillary bleeding. Arterial bleeding means to say it will be bright red in color. It will be pulsating. Venous bleeding can happen in the lower limb extremities. For example, in a road accident or a building collapse, somebody's leg is injured. If it is severely crushed, there may be venous bleeding. So why it is important? Because if we don't stop the bleeding, in case of arterial bleeding or a venous bleeding, person will die due to blood loss. Capillary bleeding means to say there will be slight oozing of blood, nothing to worry. We can stop with a simple method. But arterial and venous bleeding, its first responder should know that and should able to stop it till the person reaches to the hospital. Okay, so how to stop external bleeding? So remember the simplest method of stopping the external bleeding. First, check the wound carefully. So in any disaster, train accident, bus accident, building collapse, or any situation where there is an injury, first check the injury. Remember Dr. ABC. Dr. ABC means to say danger, response, airway, breathing, and circulation. So check the Dr. ABC. Then first, when you check the examine the wound, don't waste the time for searching disinfectant. Means to say anti-infective like Dettol, Savlon. Don't waste our time searching for that. So our aim here is to stop the bleeding. So apply the direct pressure over the wound for 10 minutes. Remember the 10-minute in first aid. We have to apply the force continuously for 10 minutes. Then only the bleeding will come under control. We can use a kerchief, we can use a gauze, we can use any first aid or bandages also for that. So first step is direct pressure examination. Second step is direct pressure. Third step is elevation. So if there is an injury in the hand, we elevate it. If there is an injury in the leg, we elevate the leg. The reason is to reduce the blood flow to that area. So please do remember these two important steps in case of management of bleeding. So I've seen people making an injured person drinking water, putting water on the head. All these things will not be of any help. Putting many people try to put coffee pudi, tea pudi, and whatever the powders, coffee and tea powders, or whatever the thing locally available also they will put on the wound, which is not at all helpful. It is a myth again. You have to apply the direct pressure, elevate, simple as that. You don't need any medicine to control the bleeding, simple as that. If the bleeding is more profuse, you need to have constructive bandages. It can be applied using any simple cloth material, or it can be applied using a kerchief also. So first step is pressure, second step is elevation, and the third step is bandaging. So why we need to put bandages? So many of the people are under the assumption bandages should be placed by the nurse, paramedic, or by the doctor. Not so. It should be placed in the field only because there will be a lot of blood loss if you don't put the bandages immediately. So bandage will help to reduce the blood loss. It will help to prevent infection also. It will provide a comfort to the person also. So remember, in your vehicle also, please do keep first aid kits consisting of triangular bandages and the roller bandages. Triangular bandages is of great help in case of any emergency, which is commercially available, which may cost 10 or 15 rupees. You can get it from the market. So make sure that when you have undergone such training, we also should equip ourselves basically, not an advanced kind of a help, a basic kind of help we can provide in any such injuries. So remember, when we provide first aid, your safety first. So for your safety, always use gloves. I keep gloves in my every bag. I keep gloves in my vehicles also because you don't know when you come across an injured patient. So at that time, if you have a gloves, you can do more good work. You can stop the bleeding. You can control the bleeding without the fear of cross infection. So if you don't have a gloves, we hesitate to touch a person who is having bleeding profusely. So if you don't have a gloves, we can use any other barriers. So barriers can be a plastic sheet, a plastic cover also can be used as a barrier, but standard, if possible, keep gloves. So there are some videos also in this. I don't know whether the video will play, but we'll go to the next slide. That is about management of other type of wound. So generally in any disaster, these are the first aid when it comes, if there is a fracture of bone, the fractured bone needs to be stabilized. So if the fractured bone is seen outside, don't try to put it in a position. The first thing is stabilize it using any stick, scale, book, or something like that. So stabilize the wound, stabilize the wound using any kind of a splint, wooden splint, or you can use even a stick also, or you can use any locally available material like a plastic bottle also will be of great help. A 1 liter water bottle, you please take out the water and compress it and apply to the fractured below the fractured end. That will help as a stabilizing the wound. Okay, and if there is any embedded object, if you have worked in any disaster areas, it's a quite common thing to come across people with a struck with a object like metallic object in a case of a building collapse, earthquake. It is common to see sharp object which is penetrating inside. So in such case, don't try to pull it out. If you try to pull it out, the bleeding may be severe, which cannot be controlled with the simple measures. So what can be done here is you can make a ring pad using a kerchief or a towel. Just put the ring pad around that wound, around the glass or a metallic object so that it will not go further deep inside. So many people will say if it is rusted, we need to take it out, otherwise it will result into tetanus. Yes, definitely it may cause tetanus, but the disinfection, vaccination, injections can be taken care at the hospital level, but don't try to pull it out. If you try to take it out, it's going to aggravate. So if any object which is stuck deep inside, not to be taken out. So and the amputation is the one thing that can happen during any disaster, amputation injuries. So during amputation, we put tourniquet. Tourniquet means to say it's a kind of a pressure that can be applied to the main artery which supplies to the hand portion. If you can see the hand portion here, they have put a towel tightly around the upper part of the arm so that the blood flow is reduced to that part. And very common thing in case of a bus or a train accident is a bleeding from nose. It is because bus and a train is a moving object, and when suddenly it comes to a stop, the person who is traveling on that bus or a train tend to fall. And when they fall, the first thing that can happen is an injury to the nose, and that results into bleeding. And they will become panic, thinking that something severe has happened. Due to a direct injury to the nasal bone, it can cause a bleeding from the nose, and which will be much severe. So the simple method to manage it is ask the injured to sit down, reassure him. You can ask them to bend the head forward, not backward. So there is again one common misbelief is that whenever there is a bleeding from nose, we tend to ask the injured person to tilt the head backward. If you tilt the head backward, the blood will enter from the nose to the ENT system, to the throat, through the body, or inside the digestive system. So it will not go inside the blood vessel. So there is no point in lifting the head backward. It should be lifted forward. Nose should be closed for 10 minutes. Remember, 10 minutes applying the pressure on the soft portion of the nose. So 10 minutes when you apply the direct pressure, the bleeding will come under control and it will stop also. So then the disaster situation will be having a condition called internal bleeding. So internal bleeding means to say bleeding from the skull or bleeding inside the abdomen. So these are medical emergency, and the golden 1 hour concept applies here. Please remember your role is to identify. We cannot do any first aid here. We have to shift them as early as possible, as safely as possible. So in case of head injury, there may be bleeding from the nose. And in case of abdominal injury, due to a road accident or a building collapse, or this kind of injury can be seen during stampede also. Kal Tulita now recently nodidwe. We have seen stampede mass congregations in Tirupati and in case of Mahakumbh Mela also. If you see such things, don't think that it's only external injury. It is an internal injury. How do you make out it's an internal injury is when you just apply pressure there. When you touch that portion, the pain will aggravate. That portion will be rigid and the person finds difficulty in breathing. There will be cold extremities. Hand and the leg portion will feel cold. And in case of a head injuries, there may be bleeding from the nose, but how to differentiate this from a direct injury and a head injury? In case of a direct injury, bleeding will be very profuse. In case of head injury, only a drop of blood can come out of the nose mixed with the cerebrospinal fluid. So our role here is to not to judge that he's having head injury, he will not survive. So there is a belief among the people that the person with a head injury will not survive. It's nothing like that. Try to make shift him as early as possible. Okay. So in case of fractures, as I already mentioned, there are two types of fractures are there, open and the closed fracture. Open type of fracture means to say bone ends can be seen outside. And in the closed fracture, the bone ends are difficult to see and only swelling and the pain can be seen. So in both the conditions, what we do is stabilize with the splinting. You can see they have used plastic pipes here for splinting that can be used. We can use a triangular bandage as well. So using a triangular bandage, we can make an arm sling after we put a splint on that. Okay. So there are improvised slings are there when nothing is available. We can use such kind of their shirt and jacket itself to convert that into a sling. Here you can see a book, a magazine is used to make as a splint. And in case of a spinal cord injury, so when you suspect a spinal cord injuries are suspected in case of a building collapse, in case of a stampede, in case of a high velocity injuries. So how do you know that there is a spinal injury? So spinal injury, how do you know that there is a spinal injury? The simple thing is the person will be unable to move. If the person is unable to move, he is unable to move his hand and leg, that indicates that he is having spinal injury. All care should be taken. All care should be taken to shift him. Don't try to hold him by leg and hand. So if you hold him by leg and hand, the situation will get aggravated. The person may go for paraplegia, permanent disability for his lifetime. So please remember, spine board is a must. Moving the casualty very carefully with a woodlock position is a must. We call it as a woodlock position. Woodlock means to say the head and the body will be moved in one direction only. Okay. So there are different methods of carrying an injured. Okay. These methods are applied for a person who is not having a fracture. Only he is unconscious, maybe due to drowning, maybe due to fire and smoke, maybe he's unconscious. We can use simple method when you don't have a stretcher, pick a back method, fireman lift method can be used. So this is one of our training. We do give practical trainings also, field trainings also. I'm also trainer for the government of Karnataka Police Department as well as for the Administrative Training Institute. So these are our trainings from the past. Okay. So fireman lift is one of the easy method. Our youth can be trained on this method to hold the casualty on the shoulders in case of any emergency, to move the casualty away from the danger as well as shifting them to a stretcher or an ambulance. The simple method is, this is wrong method. Please don't follow such methods in shifting. This method, if you can see here, a person injured is held by leg and hand. If you try to shift him by holding the leg and hand, bleeding will aggravate, wound will get opened, pain will get aggravate, the bone will get displaced. So many things will happen. And if he is having spinal injury, he may be disabled for his lifetime. The simplest method for transporting a such kind of injured person is human stretcher. So if you can see this picture here, the three people are standing down, sitting down with a three-leg down position, extending their hand, supporting the neck, back, thigh, and the leg portion. So once they stand up, you can make out that it will be acting as a stretcher. We can use this simple method. You can see that the leg and the hand portion is not held. It is supported. This is again from one of our training. This training was for the ANF, Anti-Nexal Police Force. But this is, you can see me on the other side holding, supporting the casualty, and three commanders from the ANF are holding that injured person. So this is again one of the simplest method where we can shift the casualty, hold the injured person, and load the stretcher or loading an ambulance also. When you don't have a stretcher, for example, Orissa triple train tragedy, if you remember, there were around 1,000 plus injured persons. We don't have an access to the stretcher. we have hardly 30 to 40 stretcher. At that time, blankets were used, hands were used as a stretcher. So this is how we can make a simple stretcher using our hands. Then this is a method where the kids will play. The children will play using this method. This is again one of the effective method. We call it as a human chair, joining our four hands and making it a human chair. So when it is advised, a person if he is unable to walk, a person who is having injury in the leg or hand portion, leg or chest and abdominal portion. So in such injuries, we use four-hand method. So standard stretcher, if it's available, it's well and good. When it is not available, then we have to adopt all these techniques. Okay. And a person with a heart attack or injuries, we can use chair also to shift. Instead of wheelchair, we can use a routine chair supported by two people. So when many volunteers are available, we can use blanket. So this is you can see here the blanket or the carpet is used. So this is very simple technique, but the advantage of this technique is the person will be in a one plane. The chances of injury aggravating also will be very less. And you can see that the people are standing facing each other, holding and supporting extending their hand. So this is again one of our training. The blanket stretcher has been prepared here. You can see that we have used a ground sheet actually in this training. The ground sheet is one of the simplest tarpaulin sheet which is available, which can be converted into stretcher. So blanket stretcher is commonly used type of a stretcher in case of any emergencies where the stretcher is not available. If the person or a patient is on the bed, so the bed sheet itself can be acting as a stretcher. We can just roll it facing each other and hold it in this posture and we can shift it. Okay, so drowning is one of the common thing. Next part is about the drowning and the measures for the drowning. So drowning is one of the common drowning. Yes, sir. Drowning is one of the common thing that is reported in India now. Drowning is most commonly seen during summer, not during rainfall season. Reason why is most of our youth will go for swimming to nearby lakes, river, pond, or by the dam backwater also. They go in groups of 3 or 4 people, and one of them may not be knowing swimming properly. When he starts to drown, the other people will try to help him, but they don't know the simple methods of rescue also. They also get drowned. So we have seen every Saturday and Sunday, the people getting drowned in the river water, people getting drowned in the lake. And most of them, the drowning cases reported in Karnataka, they are all youth only, college students or school children. So please sensitize our students regarding the prevention of drowning. Measures can be taken to prevent drowning. And if somebody drowns, how we have to rescue them, how we have to provide a first aid. So this part, try to sensitize your students regarding the drowning management. So in the drowning management, the first thing is if somebody is drowning, yaro neernalli mulugidre, don't jump into the water. Please don't jump into water. You have to rescue using stick, using rope, using cloth only. Non-contact rescue is the best rescue. If you are an expert swimmer, even you may be putting yourself into a danger. You have to use a life jacket if you are entering water. So non-contact rescue is the best rescue. We say we can use a board, we can use sling, we can use rope, we can use cloth material also to prevent drowning. So drowning is the commonest thing that is reported in India. These things are the floater devices that can be prepared and kept ready in case of areas where there is a many drowning cases are reported. For example, there are many river backwater is there, river or common, what I can say, there are rivers where drowning cases are reported. Such kind of floater device can be used to rescue. This is a very simple device which is made up of 15-liter water can, and that is converted into floater. And even the people can be sensitized, our youth can be sensitized on how to prepare a life jacket when there is nothing, no availability of life jacket. This is again life jacket which is made from a plastic bottle like a Pepsi or a cola bottle can be converted into a life jacket by tying it tightly, cap closed. We need to close the cap, tie it around the chest, around the waist, and tie it around the back also. So if it is possible, 5 to 6 bottle is more than sufficient. That will make the person to float. He will not drown in the water. So we can keep it prepared when somebody goes for swimming, when the youth go for swimming in a group, they can take this. If somebody doesn't know the swimming properly, they can use this for swimming. Okay. So when we are rescuing with a contact rescue, the approach should be from the reverse side, from the back side. The approach should not be from the front side, for the very reason that if you approach from the front side, the person, if he is conscious, will hold you, and the person, the rescuer, will be unable to swim, and he also may get drowned. So if you're entering water, if somebody is entering water in case of drowning, the first thing to be remembered is using a life jacket. So life jacket is a must when you are entering water. And so if a person is conscious, if a person is unconscious, but he is breathing after he is rescued from the drowning water, if he is rescued from the drowning water, but person is breathing but unconscious, he will be placed in recovery position. So this is recovery position. You can see the position here. He is made to rest on one side. Why this position? Because it will help the water to drain out. Chest muscle will be in a relaxed state and person can breathe easily. If the person is not breathing after you rescued him from the drowning, drain the water. So the method of draining water is not like what we have seen in the movies. You have seen in the cinemas, like people tend to put pressure on the abdomen to drain the water. So if we tend to put pressure on the abdomen to drain the water, only the water from the abdomen will be drained. Our aim is to drain the water from the lungs. So that can be established by this procedure. So that is putting the person with a face down position and applying pressure on the shoulder blade. Okay. And next thing is mouth to mouth breathing and the CPR. We are going to learn CPR now, how exactly CPR needs to be performed in case of any emergencies. So these are the improvised life jacket that can be commonly used for any emergencies. Like the first one you can see is made up of dried coconut, improvised life jacket. The second one is prepared using a water bottle, and the third one using the water can. So it is very essential to make sure that these improvised life jackets can be kept prepared ready. This is from one of the exhibition on disaster management where this photo was taken. Then you can see one of our training at Odisha, where these youth are asked to prepare the life jacket using the bottle. They have used, they have prepared, they have tied themselves, and once they enter the water, you can see them. Once they enter the water, you can see them that they will float. So the person at the center is having a standard life jacket. The other side, on the both the side, you can see with a locally available material. So drowning is a commonest thing. Please do remember the simple things of rescuing and draining the water, providing the CPR. So how to provide CPR, we are going to learn now. Kindly sensitize your students at your college level regarding these issues, because it's very important to save the lives. Many precious lives have been lost due to drowning in the past. So these are all preventable deaths, and measures should be taken to prevent, to sensitize our youth regarding such issues. Then the burn injuries, fire and burn injuries. So fire is the commonest thing that can happen in any buildings or in any industry or any workplace or at home also. So how to control the fire? As you know, the fire is a chemical reaction which requires three essential things. One is heat, the second one is fuel, and the third one is oxygen. If we take out any one of it, the fire will be under control. So if you remove the oxygen from the fire, fire will not be continuous, fire will be under control. If you take out heat also, the fire will be under control. If you take out fuel also, the fire will be under control. So these fire extinguishers are given to the colleges, you may be aware, and there should be at least 10 persons in the college who are trained to operate this, not 1 or 2%. Because if you train 1 or 2% to operate this, on that day, when there is an emergency, they may not be available and rest of the people may not be knowing how to operate it. It's a very simple mechanism to use and operate these fire extinguisher. These fire extinguishers are commercially available. Make sure that your college is having one fire extinguishers, particularly because college and the school, as I repeatedly mentioning, these are the places where there is a dense occupancy. Means there will be hundreds and thousands of students will be there. A small incident can cause a disaster, resulting into death and injuries also. So how to use fire extinguisher? The fire extinguisher can be used with a method called pass method, PASS pass method. So PASS pass method, it means to say we need to pull the pin out. Once we take out the pin, we need to aim the fire at the base of the fire, then squeeze the trigger. When we squeeze the trigger, the fire extinguisher, either the liquid, water, or the powder will come out, and we need to sweep it. So there are different types of fire extinguisher. Remember the ABC classification of fire extinguisher. ABC classification means to say not airway breathing circulation. A type means to say A type of fire extinguisher can be used to control the solid fire. B type of fire extinguisher used to control the liquid fire like petrol, oil, diesel, kerosene. And C type of fire extinguisher is used to control the gaseous fire like methane, ethane, of fires which is related to LPG gas. So such gaseous fire can be controlled using C type of fire extinguisher. Okay, so we have some videos. I don't know whether the video will play now. And please remember the simple do's and don'ts during a fire. And kindly educate this also to your students, because this can happen anywhere during their life. And definitely the knowledge what you have given them to save themselves during such fire will be of great use. So one thing, if there is a smoke, if the smoke is rising from the building, never try to jump out of the building. There is a very simple method to evacuate the building. Whenever there is a fire in any building, the whole building need to be evacuated. So please don't waste your time in that situation. Come out of the building as early as possible, as safely as possible. Never try to run out of the building. Walk swiftly. Make sure you know where exactly the fire exit down. So each building, your college building also should have a safe fire exit. At the same time, a safe fire assembly point. So when you know the safe assembly point, we can assemble there till the emergency is called off. So the best thing to be followed is one thing is how to come out of a chamber or a room which is filled with the smoke is cover your nose with a wet kerchief. Try to crawl, not walking. If you walk, the smoke will rise above. The smoke will be at a higher level because it is lighter than the air, and the air will be at the lower level. Okay, so please remember that. Never try to walk or run in a smoky chamber. If you do that, the person will end up with a difficulty in breathing, then burning a sensation in the eyes. You will be unable to open the eyes also. So best method is crawling outside. Then to control the fire, the best thing is blanketing method. Blanketing can be used, and if somebody's cloth is on the fire, you can use blanket, or you can make him to drop down and cover the drop down and roll. So drop down and roll method is also one of the good method to control the fire if somebody's cloth is on the fire. So among the way, there are various types of burn injuries are there, but the treatment means to say the first aid before we shift the casualty to the hospital is putting water. So how long you are supposed to put the water? Water should be put continuously for 10 to 15 minutes as the burning sensation subsides. And the second thing, there is a myth among the people that putting water will cause blisters. So these blisters will not form due to water, it will form due to the heat only. So due to heat, there is a thermal expansion of the skin and the connective tissue resulting into accumulation of fluid inside a blister. So never try to open the blister. The best thing for the first aid for burn injury is putting water, covering it with a plastic cover, which is having small holes inside it to prevent the dust falling on the burnt wound. Okay. So for major burns or the minor burns, remember to put water for minimum 10 minutes. Okay, so then comes important. This is about the fire and burn. So far, we learned about 4 important incidents. One is about the injury management, fracture and bleeding. Second, we learned first aid about the drowning, how to prevent drowning, what all the measure can be taken, how to drain water. And the third thing we learned is fire. So how to use a fire extinguisher and what should be done in case of a fire. So in case of fire, never try to jump from the building, try to rush out of the building as safely as possible. Okay. Then the third important is CPR. The CPR means to say cardiopulmonary resuscitation. So we are going to learn here in this part how to do the effective CPR. Effective means to say not just compressing, but doing an effective compression that provides oxygenation to the brain. Okay, so when it comes to CPR, you may have heard about this procedure indicated in case of a heart attack. But this condition is, this method is indicated for many situations like when a person is unconscious, not breathing after a severe injuries and bleeding. So when a person is having a severe electric shock resulting into unconsciousness, if a person is having asphyxia, asphyxia is a condition when the person is having a lack of oxygen due to the fire. In case of drowning also, that is again the indication for CPR. Heart attack, a condition of heart attack when person goes for unconsciousness and apoplectic reaction. So how exactly we are supposed to do the CPR? It is through the CAB method. CAB means chest compression, followed by airway opening, followed by the breathing. So we examine with the ABC method and then do just chest compression, followed by airway opening. So how exactly it should be done? All right. So we will go step by step. This is a very important procedure. I advise you that in your district, we have Red Cross units. You can approach health department or Red Cross unit for providing you the first aid training practically. You can learn these skills. You can try this on the mannequin. More confidence will be there when we learn this practically. Okay, but definitely knowledge is also very essential many a times to save the lives. It is not that online training probably we may not get much what I can say information to save life. Definitely knowledge is required and skill is also equally required. Knowledge can save the lives, particularly knowledge about the ER, emergency response. So first thing is shake and shout. If someone is unconscious after drowning, you have rescued him, he is not breathing. So next thing is you have to call an ambulance. Check the pulse. Before you checking pulse, call the ambulance 112 or 108. Then if there is no response, no pulsation felt, remember how to check the pulsation, hand as well as the neck portion. So we need to check the pulse, assess the circulation. If the pulsation is not felt, immediately we have to locate the sternum. So sternum is the bone which is located at the center of the chest. It's a flat bone. The chances of fracturing of a flat bone is very less. Heart is located at the center of the chest, tilted towards the left side. Heart is not on the left side. So please don't apply pressure on the left side. Please don't apply the pressure on the tip of that xiphisternum. You tend to break it. If you apply the force on left or right side, the rib cage will break. So we have to apply the force on the center of the chest. Then you remember your hand position. So find out the tip of the sternum bone. 2 fingers above that, we keep one hand, lock it with the other hand. So when we do the chest compression, we do it hard and fast compression. Remember, hard as well as fast. So how to do hard and fast compression? So every time we compress, it should be compressed minimum of 4 to 5 centimeter or 2 inches. So remember 4 to 5 centimeters or 2 inches. And what should be the rate of compression? The rate of compression is 100 per minute. So the rate of compression should be minimum 100 per minute because normally the chest will be compressed, pumping the blood to the vital organs, that is 70 to 80 times. So when we do CPR, we compress it for 100 per minute. The landmark is center of the chest, above the sternum, tip of the sternum. Then what should be the depth? 4 to 5 centimeter, 2 inches, or roughly 1/3 of the width from the chest to the back. Okay. So then we open the airway. You can make out in this diagram how the airway get blocked when person is unconscious. So tongue will fall back. When the tongue will fall back, the person finds difficulty in breathing. So then important thing to be remembered here is opening the airway. So how we open the airway? Head tilt or chin lift method. We tilt the head or open the airway. Then after opening the airway, head tilt or chin lift method, then next thing what we do is look for the chest movement. So look, listen and feel. Remember, as we need to assess the breathing by look, listen and feel method, not by keeping our fingers near the nose. So how long you're supposed to do that? 10 seconds. Remember platinum 10 minute. Platinum 10 minute means to say this procedure should be activated within 10 minutes after the person goes for shock or unconsciousness and the breathing has stopped. There are many incidences in the past where the people have died due to lack of proper response immediately. The case I can remember, the tragic death of the famous Kannada film actor, the Puneet Rajkumar, if you remember. So on that day, when he went for unconsciousness, he had a chest discomfort. He reported to a clinic. He was advised to go to the higher hospital. He collapsed there. And when he was shifted in his own car. And nobody did anything when he was shifted. So he went for unconsciousness. They were held in the traffic for 20 to 30 minutes. And during that time, nobody gave him mouth-to-mouth breathing. Nobody gave him chest compressions. So if somebody has attempted this procedure during that day, the chances of his survival would have increased by 80%. The reason is after 10 minutes, the brain, if it stops receiving the oxygen, the brain cells will die. So no best hospital, no best expert doctor, no best medicine in the world can bring him back. So please understand this limitation in any case of emergencies like fire, road accident, or drowning, or any emergency situation. If person is unconscious and not breathing, immediately activate the CPR. You have to do the CPR. So when we give mouth-to-mouth breathing, make sure that nose should be closed, head should be tilted back, and the person who is doing it should take the deep breath and blow through the casualty's mouth. Okay, we should blow through the casualty's mouth. Head lift and chin, head tilt and chin lift. You please remember that. Then how long you are supposed to blow? Steadily for 2 seconds. And how many breaths we give? We give 30:2. Every 30 compression followed by 2 rescue breathing. So remember the posture when we do the CPR. So when we do the CPR, you should be rested comfortably with both the knees down position on the ground, with both the knee position on the ground. Hand should be extended and it should be perpendicular to the chest wall. As you see on your right side of your screen, you can see a lady, a first aider doing the CPR. That is a perfect posture of so sitting with both the knees down position close to the patient, hands extended, no elbow bend, force should be applied from the shoulders. So how long you are supposed to do this? How long we are supposed to do this is till the ambulance arrives, till the casualty is shifted to the hospital, till somebody takes over from you. If you are in danger or if the casualty is in danger, till that time, you will be doing the CPR. So remember the 5 steps. First, call for an help, 108, 108 or 112. Then next thing is start doing the chest compression. The third thing is open the airway, give mouth-to-mouth breathing, and we need to do 5 cycles before we apply ED pad. ED means to say automated external defibrillator machines, which we use commonly in case of any kind of a severe defibrillation or severe kind of a heart attack, or a person if he's not responding to any other method. So there are some videos. I'm not sure whether this video will play. Yeah. So remember the steps of CPR and continue resuscitation until the qualified help arrives. The victim shows signs of life. If the person is showing signs of life, for example, recent one incident I can remember, is a senior citizen in a train, had a heart attack. He was traveling with his son. So on that day, his son tried to help him, but it was of no use. He tried massaging the foot and the leg portion. He tried to massage the hand. He tried to give water. Nothing helped. So then he called a helpline number, the 139, the railway emergency number. The staff members of the railway, the running train itself came forward to help. The TT performed the CPR. So the TT, the ticket examiner, performed the CPR continuously for 20 minutes. And the next station was alerted to keep the ambulance and the stretcher ready. And before the next station arrived, the senior citizen who had a heart attack so started showing signs of response. He started breathing, but he was unconscious, but he was breathing. And in the next station, he was shifted to the hospital immediately, and he survived from that heart attack. So there are many such incidences are there where CPR has helped and recovered, helping in recovering patient. So after CPR, when we wait for ambulance to arrive, we turn the casualty to one side. So this posture is called a recovery position. So recovery position means to say a person will be easily able to breathe due to chest muscle will be in a relaxed state. So how to put a person to a recovery position is very simple. Leg and the hand should be made in bent like a L shape and turn towards your side. That's all. So this is a very easy thing to do. But when it should be done, when the person is not conscious and breathing. Breathing is that, but he's not conscious. In that situation, we do this. Okay. All right. Then comes the last thing is about particularly that is for when it comes to any disaster is common thing that we come across is snake bite. So this is again a common thing to be seen in case of a normalcy, in case of a flood. So during flood, you may have heard about a snake entering into the water, snake entering into the houses. And in some districts and states, we have seen crocodiles also seen in the water. So snake commonly seen, and the snake bite is a common thing and reported. More than 1 lakh death is reported in India every year due to snake bite. So what is the first aid for the snake bite? So snake bite, the basic first aid to be remembered in case of a snake bite is first is identification. So by looking at the snake also, we can identify that as a poisonous or non-poisonous based on the anatomy of the snake. So generally the poisonous snake will be having a broader head compared to the body size. The scales, ನಾವು ಕನ್ನಡದಲ್ಲಿ ಏನು ಪೊರೆ ಅಂತ ಹೇಳ್ತೀವಿ, the scales will be very close. ಪೊರೆಯಲ್ಲಿರುವಂತಹ ಚೌಕಗಳು ತುಂಬಾ ಹತ್ರದಲ್ಲಿರುತ್ತೆ. Then the eyes when the pupil will be elliptical in case of a poisonous snake. When it comes to non-poisonous snake, the head and the body will be of a same size. The pupils will be rounded and the scales will be far apart. So this is how to differentiate. This is important for providing first aid. So when it comes to the wound mark, if you generally see the wound mark of a snake bite, poisonous snake bite will be having a two prominent mark. You can see the on your left side. So the two prominent marks are there. There will be a swelling and there will be a color change also. But when it comes to the non-poisonous snake bite, it will be having multiple marks, bite marks, and it will be bleeding profusely. And as well, one more important thing is there will not be any color change or a swelling in case of a non-venomous snake bite. So non-venomous snake bite or non-poisonous snake bite, we need to identify, reassure the casualty. So generally, if you see that, if you see these pictures here, you can make out very clearly. And symptoms of the snake bite, generally symptoms of the snake bite can be seen across the body, across the organs, depends upon the types of toxicity. The three types of venomous poisonous snake we see, the first one is called the hemotoxic, which makes the blood vessels and the blood toxic. And the second one is called neurotoxic, which makes the nervous system into toxicity, which spreads its toxicity or the venom. And the third one is cytotoxic. For example, now Kannadadalli we call that Kolkumandla how kelirbodu ನೀವು. So that is cytotoxic, which makes the gangrenous cell death wherever it has bitten. So how much time we have for a snake bite is 1 hour. Remember the golden 1 hour. So what is the first aid to be done? There are many myths related to the first aid of providing first aid to the snake bite. The common myth is you may be knowing that cutting the wound, sucking the wound, putting a tourniquet, these are all myth again. It's of no use. Science has repeatedly proved as well as repeatedly actually mentioned in the science that don't put a tourniquet, don't cut the wound, don't suck the wound. So what is the first aid? First thing is reassure, make sure that the casualty is not under shock, and make sure that he is not worrying about the snake bite. Make him to reassure saying that it's a non-poisonous snake bite. So nearest hospital is having a facility to treat that. Then clean the wound thoroughly with the water and the soap solution if it's available. If it's not available, go for the next step. First, cleaning the wound. Second, next step is immobilizing it. So you may be surprised to see here both the legs we have tied here. So immobilization, why it is required to prevent the tissue absorption. So one thing, the second thing, we will be using a cloth material or a crepe bandage or a roller bandage will be tightly wrapped above the wound. Wherever it is bitten, above the wound, will be using a bandage, not tourniquet. ಕನ್ನಡದಲ್ಲಿ ನಾವು ತಿರುಚುಪಟ್ಟಿ ಅಂತ ಹೇಳ್ತೇವೆ. So don't use a rope, don't use electric wire, metallic wire to tie tightly. Don't do that. If we do that, the respiratory arrest can take place due to stoppage of the venous return to the respiratory system. So please remember to tie only using cloth material, immobilize it, don't cut the wound. So cutting the wound is contraindicated because if the most of the poisonous snake bite, it is having a hemostatic property which stop the blood from oozing out. You cannot remove the poison completely by cutting the wound. It is not at all possible. Then sucking the wound also is not required, not advised. It's contraindicated again. The person who has sucked the wound, due to the lymphatic supply below the tongue, it can cause harm to him also. So sucking the wound, cutting the wound is not advised. 3 steps to be remembered in the snake bite. First step, reassure, reassure, and reassure. Okay, we call it as counseling. ಅಂದ್ರೆ ಅವರಿಗೆ ಧೈರ್ಯ ಹೇಳೋದು. The second thing is immobilize. Immobilize means to say, make sure that it is at the lower level compared to the chest or the heart level. So immobilize it. The third thing supposed to be done is using a roller bandage or a cloth to be tied behind the wound, above the wound to reduce the blood circulation. So these are the 3 things to be remembered in case of a snake bite. There are many other myths related to snake and the snake bite, but it is not like of any help. There are guidelines issued by the government of India and the WHO regarding snake bite because even though there is a lot of effort being taken by the government to reduce the cases of death, but even today it is not coming under control, the death due to the snake bite, due to 3 reasons. One is the myth among the people. Second, the immediately they don't bring him as early as possible to the hospital. They bring him maybe after 1 hour or 2 hours after they take him to some local astrologer or some local villager or a local person who gives some medicine, who doesn't have a qualified background also will be giving medicine in many villages for the snake bite. So there are many reasons for the death, but please to remember the 3 important measures to be taken. And all the hospitals are supplied with anti-snake venom. ASV is being supplied to even to a PHC also. But make sure wherever your college is located, if the inside the college campus, within the college campus, if the snakes are reported by the students, so be cautious about that. Make sure that find out from the nearest PHC how many ampules of ASV they preserve generally, how many ampules they have, how many supply they have, and put the board in the prominent places regarding the threat of the snake there. And make sure that the people who are walking should be wearing shoes, always. And if the snakes are frequently seen inside the building also, you have to take the help of forest department to clear this off, because most of our colleges may be located in rural area, in a area surrounded by forest. So there is a very likely possibility that the snake may enter inside the campus or the building. So when there is a snake bite, please remember to follow these three important methods and the measures to be done. Then shift them as early as possible to the nearest hospital. So the nearest hospital which provides having a supply of ASV. And remember, it's not 1 or 2 ampoules of ASV will be sufficient to save a life. Sometimes it requires more than 20 ampule. 20 ampule means to say 20 small capsule bottles. You may have seen the ampoules of ASV, anti-snake venom, is required. So these ASVs, anti-snake venom, actually should be stored in a freezed condition. So most of the PHCs may not be having a continuous supply of a power also. In that situation, the efficacy of the ASV is also reduced. Make sure that you are actually taking him to the right hospital in such situation, because time is very crucial here. And there are many other myths as well related to the snake bite, but these are all myth only. The science doesn't support whatever the wrong belief the people are having. So this is about the basic first aid to be remembered during any disasters. So what we learned here basically is on 4 important issues. That is, one is on management of injury. Like in the injury management, we learned about how to control the bleeding, applying direct pressure, elevation, and putting a bandage. Then how to stabilize the fractured portion using a splint, wooden splint, scale, stick, or something like that can be used. Next, we learned how to shift the casualty. So when we are shifting the casualty, when we are shifting the casualty, what measures to be taken? We learned about that, shifting casualty, using hands, using structure, using blanket, how to shift a casualty. Then we learned about fire. In case of fire, what are the do's and don'ts? Then how to control the fire, what measures should be taken while coming out from a smoky chamber. Then third, we learned about the drowning. Fourth, we learned about the drowning. Drowning is about how to prevent drowning is one. Drowning is a preventable death. Seriously, college authorities and the teaching faculty of the college should take measures to prevent drowning related death in your college, because most of the youth on the weekends, they go to the nearby place for swimming and they get drowned. These are preventable death. So fourth one, we discussed about the drowning. After that, the very important, the fifth one, which we discussed is about the CPR. We call that as cardiopulmonary resuscitation, and the basic life support, the B.L.S. it's known as. So how to turn the casualty to recovery portion we learned. Then after that, we learned about snake bite, which generally can happen during disasters or it can happen during normalcy also. All right. So I'll stop here. This is because we didn't give a time for the questionnaire. At the first part of the session also, the first part was about the disaster management. And in that disaster management part, the one part which I didn't cover there because lack of time and the network issue, suddenly the network got disconnected and slides didn't continue there. The part which we didn't cover there was about Disaster Management Act 2005. So Disaster Management Act was passed in 2005. According to the Act, the three important things are there. One, national level, we have a nodal agency called ADMA, state level and district level also. At the district level, deputy commissioners are the head of the district disaster management authority. At the state level, we have actually the chief minister will be heading that, the state disaster management authority. And at the national level, the prime minister will be presiding the National Disaster Management Authority. Then we have NDRF, which is having 12 battalions of force. The people from CRPF, from the Armed Reserve Police, Central Reserve Police, they have been taken, they have been trained and equipped with a basic and advanced equipments related to disaster response. That is NDRF, National Disaster Response Force. The nearest NDRF battalion we have in Andhra, We have, that's the nearest one. We don't have a battalion of NDRF in Karnataka. We have nearest one is in Andhra only, because Karnataka is considered to be safe compared to the 12 states which is highly prone for the disasters. Then